Hello everyone, my name is Dr. Deepti Tikka. I am currently interning at One Public Health. Today uh, we are here with Dr. S.Tholkapiya Chezhian. He's a psychiatrist. We are honored to have you here, sir. And we are very keen to know about psychiatric and public health perspectives through you. So can you please introduce yourself?
Yes, yes.
Yes, sir.
Yeah, good afternoon, your Miss Deepti, right?
Yes, sir.
Yeah, I'm Dr. S.Tholkapiya Chezhian. I'm a consultant psychiatrist in Vellore. I did my MD Psychiatry in Pondicherry Institute of Medical Science in 2017 to 20, and I'm currently practicing in my own clinic, Shelva Shakti Clinic in Old Katpadi for last 5 years. It's been 5 years of journey into the field of psychiatry. Yeah,
Okay, sir.
thank you.
Uh, yes. So I would like to begin with our questions. From your experience as a psychiatrist, how would you define substance abuse and addiction, and why should we view it as more than just a personal habit or as a behavioral issue?
Yeah. So regarding the topic addiction,
Yes, sir.
we generally, as a psychiatrist, tend to name it as a dependence pattern. Okay, and according to ICD criteria 10, it is said that any habit which is having a very strong desire or of a chronic time, like probably more than 6 months to 1 year, the
Mm,
pattern has been repetitive in nature and in spite of knowing its harmful nature, people tend to procure the substance. We
mm,
generally name those psychoactive substances called alcohol, nicotine, that is tobacco, cannabis, opioid, inhalants, and other stimulants. Okay, and in recent ICD 11 criteria, they have also included this gaming disorder,
mm.
predominantly of two types, that is online as well as offline, because these generation kids and young adolescents are more into this gaming. It is equally addictive as like a substance. That's what been said. Yeah.
Okay, sir. So, building on what you have said, what addiction is, what substance abuse is, how commonly do you encounter such substance abuse related patients and in your day-to-day practice? And have you noticed any changing trends or the trends which are popular these days, especially in substance abuse?
Yeah. So we in my OPD or my clinic, we used to get like almost 50 to 60 cases of substance abuse, and uh, I also have encountered substance as a comorbid with along with the depression, anxiety disorders, and when compared to this global census or prevalence, it is almost like 1 million people are being dying because of alcohol use, and also like 8 million people in this world are dying because of tobacco. That is, tobacco causes cancer. Like it is a record from WHO, and also in India. The National Drug Dependence Treatment Survey of India has reported that the single most psychoactive substance which is very common is alcohol. That is because the easy availability of alcohol, and there is no particular restriction for age per se, and also this tobacco has been available even in petty shops and all. So this has increased the burden of the society with young generation being exposed to this kind of a substance use. Good
Okay,
question.
thank you, sir. That was really insightful, sir. I also want to ask you that if you consider peer pressure, other behavioral changes, and family's pressure, they take on using substances. In some states, in India especially, it is really prevalent that they use tobacco other things. So do you think it could also be a reason that is influencing adolescents and young adults to substance abuse especially?
Yeah, exactly. That particularly like as they enter this adolescent age group,
Hmm.
they get an easy exposure to this smoking, full lip,
Hmm.
and also even people of 12th grade or 11th grade, because of their peer pressure, they try once alcohol, and sometimes even in the like late adolescence, they get easily adapted to this cannabis. And normally, that is being given in powdered packets and easily being polluted in the society. In that way, it also get easily being entered into the population. And also in Tamil Nadu, it is even more recent times. It is the cases are being hiking, and the government is definitely taking necessary
Yes.
steps to cut down this measures of substance. Yeah.
So, as a psychiatrist, according to you, what are the protective measures that can be taken, especially targeting young adults and adolescents? What can we do to
Mhm.
prevent this, to stop it?
Yeah. Yeah. So we basically classify the prevention in according to primary prevention,
Yes.
and secondary prevention, and last it is a tertiary prevention. In this primordial prevention, we try to stop all this kind of pan, gutka, all these kind of an advertisements in the television can be prevented. And the as I said previously, that these substances are being easily being procured by the young generation, so their availability should be cut down. And also, the government actually it is the government is initiating sin good taxes. Okay, so they are increasing the taxes. Still, the companies and are being marketed and being still been into the markets, so that can be avoided. And according to the primary care prevention, we can go to individual schools and colleges to educate the students the harmful effects of psychoactive substance. Like later in their lives, they have some kind of sexual dysfunctions, depressions, and anxiety-related problems. And we can also educate them with a life skills training. And as a community, we can start preparing some campaigns to educate the even the general populations. And according to this secondary prevention,
Yes.
we can have some kind of screening tools like alcohol use disorder tests and assist rating scales. And we can also have the questionnaires for cage questionnaires, that is like age and guilt feelings, if they have anything like guilt feelings to have the substance, and any like an eye opener drinking. Like as soon as people wake up in the morning, they tend to have some cigarettes in the bathroom, or like alcohol. They store it in their home for to avoid hangovers. And also such kind of rating scales will make us to learn that the person is in a very severe or a serious problem, that they should be treated on a tertiary care prevention. And there comes our activity, like we tend to have this detoxification, de-addiction, rehab centers, and also we try to engage them into an anonymous like alcohol AA groups, anonymous group. And in that way, they get into a population where people have stopped taking alcohol. So they tend to exchange their experience of how they stopped and how they are functioning in the society, and that in that way that can be much helpful.
So, as a psychiatrist, from a psychiatrist perspective, have you seen any patients? Have you encountered any patients, especially adolescents, who have visited to your clinic, especially for the treatment of substance abuse? Is there any such
Yeah.
experience of yours?
Yes, actually, I mean, I'm in Bellur, I said. So one of the popular college student has been brought to my OPD when he's just 20 or 21, I think so. So he came with complaints of like severe aggressions, and he's been hearing voices of somebody talking to in a very derogatory and vulgar words. He also told me a very it was a shocking experience. Like there is some forest area near our place, like the mountains, and it's a border place, Chittoor and Vellore. So he, because of that voices of like alcohol and cannabis also, he just went to that forest and he encountered a leopard. There he said uh, he had the voices to in front of the leopard. So he was being yield to that, and he took a risk of at the stake of his own life. And lucky the leopard hadn't attacked him. I never know how that had happened, but this was a real time incident which the student told me that I was in that kind of a distress, and I want to end my life. So the parents are spending a lot of money on them, investing on them. That is what their future is all about. So this substance have made a student who is just 21. He has not even seen a lot of life struggles in his age, probably. If he is like 60, he would have crossed a lot of things in his life. But at 21, because of this alcohol only, he started having all kind of disputes, and also his academic performances were poor. He has even got a good rank in the entrance examination, and also 12th grade he had a very good scores in the board examination. So the substance have entirely shifted a student's life into this extreme to that extreme. So that is my one of the patient's experience.
That's really such a tale of an experience to tell, sir. Sir, I have observed mostly authorities or parents or schools, if they find someone who's doing any sort of substance abuse or anything, they usually go for punishment-based approaches. So if we their mentality is if
Yes.
we punish them, they'll get better. So do you think they need consultations or we need to go more towards punishment based approaches? What is your
Yeah.
opinion?
Yeah, very, very practical based question. And actually, that's what in students, in our age group, we never know, we were not being taught or known about these substances at school age. And this generation, particularly, are getting very easy exposure to this cool lip kind of a thing. And so even smoking, when they have been caught by the physical education teacher or any department teachers, I would suggest them that ask the open-ended question initially. Going for a punishment is always never a good choice. This is based on some behavioral psychology. They say there are a lot of attitudes like positive reinforcement, negative reinforcement. But coming to a punishment as a behavioral therapy, when you do wrong, you get punishment. This will not work every time. Maybe at one instance it can work, that too very short period and a very short punishment and very limited and small degree of punishment that works. But when you try to hit the child or abuse the child or you suspend the child, it even more worsen the scenarios. That is what I would suggest. The child can be sent to a nearby psychiatrist or a psychologist. Probably in these days, even schools are taking very good initiative to appoint a clinical psychologist in each schools. They talk with the child, not like you have to handle a 12th grade student, not like an adult. You have to talk with him, what made him, what is his familial problems. Whether how he got to know about this substance, whether his parents, like particularly father, is procuring substance or he's smoking cigarette in front of the child. All these factors can also attract. And also, one thing is, people think that smoking is a manly thing. That is why children start smoking.
Yes.
And the education should be in such a manner that smoking is never a manly thing. So smoking is only a personal habit which should not be entertained or enriched by any means. Okay. And that is not like they say Tamil get அப்படின்லாம் சொல்லுவாங்க. That is not actually the thing. Huh? Yeah. So we have to talk with the child. We have to analyze if he's undergoing any problems. So that can be done. And also definitely the school education, uh, like any skills learning can also be given to help the child rather than
Yes, sir.
hitting, beating,
Okay.
suspending him. That doesn't work well.
Now, I would like you to ask how, for example, a kid knows, a adolescent knows that smoking is bad for him. How will he know which stage he is in? Like, how will he know if he's abusing the substance occasionally, or does he have dependency, or it is a proper addiction? What do you think the warning signs would be? And how will family recognize
Yeah.
the warning signs for him to get help or her to get help, especially regarding this?
So it's almost knowing the literature or brushing the literature that the features of dependence. For example, the child is saying, I mean, of fabricated or manipulative behavior in order to procure the substance, or he started stealing money from the parents' pockets to get the substance, or like he's bunking the school, like in order to go for consuming any substance, or like he's unable to uh, live a normal life like anyone, like the tolerance pattern, like the previous dose is not that much giving kick for him to sustain, or he's leaving all other pleasures. Say for example, if he's good at any sports, or he is good at any I mean any like what do you say, arts, culturals, any other activities, he's sparing his most valuable times and replacing it with this alcohol or smoking behavior. So that can also be a sign to know that he is very much dependent and he needs to be treated. And I would be very happy, and uh, through you and this medium, I would educate the public who is going to see this video is that uh, taking medications and also counseling for treating substance use is what appropriate. Many of the parents who come to me, they tend to have a habit that just give me a counseling, just give me a therapy. So that is not enough. See, substance or which is having an implication in your brain. Basically, the dopamine system, the serotonin system, the acetylcholine system, the GABA system, all these things are being affected only because of these substance only. He or she is behaving in a very erotic manner or any indisciplinary manners and all. So that can only be compensated with the medications. Secondary to that, definitely non-pharmacological therapy like motivational enhancement therapy. All these therapies are available, but with the medications, the effects will be good. Don't worry about the child will get affected in the future. No, this substance is more notorious than the treatment. That is one takeaway point here. I can definitely tell through you.
Yes, sir. Coming to the point where you have said that parents only don't try to seek complete treatment, they are okay with only counseling sessions. How do you think the stigma are in our society, the stigma about especially substance abuse of taking medicines? For example, people do think that if they are seeking treatment, proper treatment, taking medicines, taking counseling, which means they are sick, and they don't see substance abuse, smoking cigarettes or drinking alcohol as a disease. So, how
Mhm.
to reduce this stigma and how to create awareness among people, especially parents, families, and also on a community based level? How to do that?
Yeah. So yeah, very good question, and it's a very practical based question. So initially the stigma, the general mass media or any this content creation, all these things can help them, the parents particularly, to overcome this stigma. Like the sports people like Dhoni, Sachin, or any other cricket celebrity or any cine celebrities, when they start preaching it, or the doctors, I mean, probably doctors are not having that great face values, whereas these sports people, when they come to the social media and then they tell that, and this can help to break that stigma. So they, when it is being told that like any other physical symptoms, mental symptoms is also being treated with the medications. And while taking medications for that per se is never a inferior thing. See, when you have a diabetes and or hypertension, you think that that is a rich people's disease, and you are very happy that I'm going to a diabetic center for a treatment, but you feel very inferior when you go to a psychiatrist or any psychologist, for that matters, like when something related to your brain. Okay. So that should be made generalized. Like they should not be, from the childhood, they should not be commented or criticized as those words like you're a mental. All these things are not good to be shared at a school level or a college level. And the second thing is, in recent days, the treatment gap has been increased, or the gap has been very much, and that can be reduced by uh, like man for like human resource force. They can be going to the nearby villages or taluks. They can educate them through some panchayats or any the counselors or the leaders of their uh, particular community, and then that way they can also be enrich the public to avoid such limitations.
Yes, sir. And what do you think the role of rehabilitation centers and preventive care centers, especially uh, by the government, also the NGOs, small youth group startup? I mean, new startups. Also, for example, using apps digitally to keep a track of the intake of nicotine and stop taking nicotine, use nicotine gums and other things like that. Do you think all these kinds of measures together combined should be used, or do you think only proper traditional method of seeking treatment and then getting better should be considered? What do you think? Which one works better?
I mean, both will work better. Okay, all the both the digital method, because people have their mobile phones in their hands, and I think almost every other adolescent child do have mobile phones. Through
Yes.
digital way of controlling the substance use, as well as the traditional way, works hand to hand. And the government also been making policies and actively enrolling people to stop this substance use. For example, for reducing tobacco, the
Hmm.
national tobacco control programs have been initiated,
Hmm.
and cigarettes and other tobacco products like Copta, I think so, in 2003 it has been launched, and it is actively being seizing smoking. And the taxation, as I said earlier, the sin goods taxation have been increased, and the government also made the general public gathering places, you should not smoke. Like smoke free public places should be created, and there only they can be smoking. That can avoid the passive smokers getting carcinoma of lung. And regarding this alcohol also, they have the state specific excise policies and drunk and drive regulation policies. Like they have increased from, I think, 10,000 to 20,000 as a drunk and drive punishment things have been implemented, and also the sales restriction taxes also been reduced. And also like there is a body called as this narcotics control body for stopping this cannabis and heroin. All these things have also been implicated. But basically, they are doing this to help the public to ensure that the the substance will make into a risk-taking behaviors of the individuals. Like particularly, for example, if they end up into sexual crimes and all, so that can be avoided by these kind of measures. And they also strictly put into a non-bailable sections, and also imprisonment has also been into the practice. So in that way, I think they are cut downing these substance intake.
That was really insightful, sir. Sir, what do you think addiction or substance abuse is an individual's responsibility, or do you think society together on their level needs to understand what their needs are, what changes to be made, and then act on it? Which approach works better?
Yeah. So yeah, there is like there are determinants of addictions. Okay, so as an individual factor, a person with a genetic predisposition can also be ending up in a substance intake behaviors, and also some kind of an, like I previously told, like comorbid mental illness, stress, and also these kind of a risk taking behavior. And also when coming to a social level, the peer pressure, like a person is getting more into the substance because of the other friend or a person who can get this substance very easily. And also this urbanization, particularly like cities like Chennai, Bangalore, Bombay, all these have a night culture, like they start having pubs, and all these can also be adding factors to the society. And particularly like unemployment will make a person to consume this, even this illicit liquors and all into the market. So it is definitely an individual's responsibility as well as the society's responsibility, which can help to avoid the consumption of alcohol and any
Sir,
other substance.
as you earlier mentioned about the data regarding alcohol use, regarding tobacco use, and you also explained how government policies are made, how they are being implemented. What do you think are the main major gaps which are prevalent and which exist, due to which substance abuse is still happening, even though these policies are already in place, these programs are already in place? Because the recent
Mm.
NFHS data
Yeah,
shows
correct.
it. What I'm trying to
Uh-huh.
ask you, sir, is what are the main gaps? Even though all the policies are
Mm.
present, all the implementation is going on, everything is going on, what do you think is the major reason behind substance abuse in India, especially? And recent reports say like substance abuse is keeping on increasing, right? So, what do you think is the reason behind it? Is it lack of
Yeah,
monitoring?
one thing is yeah.
So, yes, sir,
So
that's
one thing is I would yeah, one thing is like the substance are being easily been available, the availability of the substance, and it's very cheaper in price. So like the alcohol or tobacco, or and the newer synthetic drugs also has been available very easily to the young generations, to the schools and colleges. They start circulating among, and the governments, I mean, particularly the police personnel should be very much strict in this to take an action against such things. That one is the problem, and most important thing is the habit of uh, parents not educating about or talking about this substance. By just talking, they think that they are implementing or implanting the idea of substance. No, like once the child goes out of the house, he talks with different people, he learns different things. So as a parent, everybody should educate their children that what are the harmful things of a substance, what are they, what they do. All these things are some kind of a gap in the society that very early age they can start educating them. And definitely some kind of short films can also can help them to overcome this uh, cut downing of substance. Yeah.
Yes, sir. Finally, if you could give one message, especially to adolescents and society, all the people who are especially watching this, who our magazine is reaching to, can you give one message, especially regarding substance abuse, mental health, addiction, everything?
Yeah, I mean, from a public health perspective, the most cost-effective strategy to prevent through policy measures like community engagement, school-based intervention, strengthening the access to the evidence-based medicine, and availability of the rehab centers, and make sure that if you find anybody consuming substance, do inform the authoritative person to just not to help your friends, to help them to avoid this substance intake. Because as a team only we can avoid this substance intake behavior, not as an individual person or an individual things. Yeah.
Thank you so much, sir, for sharing your valuable insights with us, and thank you for giving us your time. And this discussion helped me, especially on a personal level. And I am hoping that it is going to reach as many people as possible, and it is going to help each and everyone to understand what substance abuse means and how substance abuse is not only a challenge on psychiatric level, but it is also a bigger challenge on community level, and how each and every single person is supposed to take measures regarding it. Thank you so much, sir.
Thank you. Thank you so much for the
Thank,
wonderful opportunity you have provided me to invite and help me to share my ideas and views. Thank you so much.
thank you, sir.
Thank you.